All right, so this is the segment where we're going to do the massage techniques. So the first one is going to be the standing technique, where we're going to roll in a standing position as well as against the wall. So in the standing position, we have the roller. So we did this last time with the tensor fascia lata as well as the front hip muscles. So using a rolling pin, you do it in a standing position on the side. So the gluteals that are on the side. So you have the height of the hip here, the highest, and you have the thigh bone right here. So that's the area where the musculature can be rolled. Got to be careful to not roll directly on the thigh bone, and then you could roll back towards the bigger glute muscle. You could rearrange it, your hand contact, to roll. It won't get the deeper muscles, but it'll definitely get the superficial gluteal muscles. So you got the roller. Now, if you have a baseball bat, again, this is the leg of a vanity that we're going to have in the bathroom. So this could be a baseball bat, and the same type of motion can occur. This could also be done with a broomstick. In those areas. And then lastly, if you want to get very specific, we had this tool out before where it's a blunt side and a wedge-shaped side. So you could definitely use that along that thigh bone, not directly on it. So when I move forward, I'm getting TFL. As I move above the bone, you're getting those gluteal muscles. And when I move at the back, I'm getting the bigger gluteal muscle and moving downward. After that, you can use the wedge shape in those same areas. Again, to get the gunkiness, the gumminess down to minimum around the attachment of the thigh bone. Now, instead of this, if you don't have it at home, you got your kitchen instruments. So the wooden spoon has a blunt edge that can use the same procedure as the Red Star massage tool that I just had. And the wedge shape to get in between the fibers and around the thigh bone area. When you use the wedge shape, it's good to make sure that you're taking the skin with you and not basically sliding over the skin, because that could cause some blistering. So make sure you take the skin with you. Now we'll move over to the wall, and I'll show you what we could do with the lacrosse ball. So with the one against the wall, foam rolling won't really be appropriate. It could slip out and it's too broad. But that's why we're going to use it for in a lying down position or seated position. So we're using a softball and a lacrosse ball. So with a softball, we're going to do the back of the hip area, so the gluteus maximus. You place it on the muscle and you feel where the height of the hip is, and as you move towards the midline, it's about right there. So all this area will be gluteus maximus. So you lean into the wall, have your legs outward, and then you can bend your knee and lean into the wall to apply the pressure of the ball into the muscle. So I'm starting around the back of the hip, again called the sacrum, right at the edge, and then I move outward. Then I just reposition and do the same motion, and then you can move side to side, up and down, and then reposition the ball again to get into the deeper fibers that are piriformis and the other muscles. Now the side, very similar to TFL. We have the TFL here. The other muscles are just back of that. Lean into the wall. Again, bend and straighten your knees to do an up-down motion, and then forward and back for a cross motion. And then reposition the ball. All around the thigh bone area. Okay. So the boundaries, again, here's the height of the hip, here's your thigh bone. So all that area you could capture when you're rolling at the side of the wall. And then with the lacrosse ball, you can see it is smaller and it gets into more of into the crevices as well as deeper tissue because of the narrowness of the ball. Now, with this standing against the wall to address those areas, the pressure won't be as great as laying on the floor or even sitting down. But I suggest if you haven't done it before, try it against the wall first so you get the feel of how much pressure there is. And once you've felt that the pressure is not substantial enough, that's when you could get into going on the floor and in the seated position, which we're going to do next.